Welcome to Legacy Spine and Neurological Consultants. We are honored that you have selected us for your care provider. We've prepared this video for you to guide you through the process so you know what to expect every step of the way. Here's a list of a few important reminders. Before you can have your anterior cervical fusion, we'll need to schedule some pre-op appointments for you. Also, you will need to be fitted for a soft collar brace for your neck that you will have to wear after surgery. The brace is a self-pay item that will be $25 the day of the fitting. You will need to bring the brace with you to your surgery, and we will also need you to have pre-op lab work done. Please arrive 30 minutes prior to your appointment to complete the check-in process. We will need you to sign a consent form and sign an agreement that you have received a copy of our privacy policy and patient information forms. We are located in the Freeway Medical Building, 5800 West 10th Street, Little Rock, Arkansas. It's very important that you confirm your appointment within 3 business days prior to your appointment. You'll be receiving a confirmation template to fill out 3 days prior to your procedure through the patient portal. You can find that by looking in your email on nextmd.com. If you don't confirm your appointment within 1 business day, it may lead to cancellation and no-show fees. It's very important that you have nothing to eat or drink after midnight the night before surgery. If you are diabetic or taking daily medications, please inform the nurse for specific instructions. Please arrange for transportation home the day of discharge. A button shirt should be worn or brought to the surgery center to wear home the day of surgery. Our office will notify your insurance company and request pre-certification for surgery and hospital admission. It's the patient's responsibility to know the specific restrictions, benefits, and clauses of their individual plan. Patients who do not have insurance will need to arrange an appointment in person or by phone with our insurance clerk to establish a payment plan. Our office will contact your insurance company regarding payment for your surgery. We will notify you of any amount of which you will be responsible. Payment is expected at the time of service unless other arrangements have been made.
Okay, well, we just finished the surgery about an hour ago and done the C5-6 anterior cervical discectomy and fusion at the outpatient center through our minimally invasive approach. And how do you feel now?
I feel all right. No pain down my arm, that's the best part.
All right, so that's what we aim to do. We aim to relieve the pressure on the nerve. Here's a model of your neck, and as you know, I went in there and removed the disc at 5-6 and freed the pressure on that nerve that ran down the arm, and then put the bone graft device in the place of that disc. So the pressure is immediately relieved, and you can tell an immediate difference already?
Automatically.
Good. Now go ahead and take her collar off. So what we do now is, the surgery went great, no problems, got the pressure freed up off the nerve. The neck is nice and supple and soft, no swelling, and we've left a drain in. The nursing personnel will go over this, but the drain's really got nothing in it, and most of the time with these kind of surgery, there's little to nothing. The drain's put in just as a preventative measure. If there's any oozing, the drain, should pull it into the drain rather than collecting in your neck. So your family, Sonny will go over all that with them in just a minute, of how to take care of the drain, what to watch for with your neck, basically any swelling that were to occur. If all of a sudden your neck swelled up, like you had the mumps or something, we would obviously need to know about that anytime. That can happen even up to a week or 2 after surgery. So anytime that any sort of intense swelling developed, any fever, of concern, drainage from the wound, or development of new neurological symptoms. All of a sudden your arms or your legs start getting numb or weak or tingly, we would obviously need to know about that. And that again could happen from potential problems that could occur after surgery, up to the first couple of weeks. Now, the likelihood of anything at all bad is extremely low likelihood, but anytime we're dealing with surgical problems, there's always risk. I think everything will go great. I don't anticipate any problems. Patients like you that don't live in the immediate Little Rock area will spend 1 night usually in town, just in case any adverse problems occur. We're therefore readily available. The next day you'll come back in tomorrow at some point after the criteria have been met with a drain that the nurses will go over, and we will then remove the drain tube, and at that point you can, if all's going well, you can head home. Okay.
Alrighty, Ms. Russell, I was just going to go over some of the post-op instructions with you. The really important parts is it's normal to have some post-operative pain. The pain that we're more concerned about is when your pain becomes excruciating, new pain that you haven't had. The pain coming back in your arm is normal sometimes, especially after surgery, because the pressure is relieved off that nerve, but then just with a little bit of swelling that can come back. So don't be alarmed. If you ever have any questions, just call us. As far as taking care of this drain, we're going to show you guys how to take care of it. We want you to milk the tube is what we call it, and so you're going to hold it way down here. You want to come around to this side so you can see a little better. You're going to hold it down here at the incision so that it doesn't pull. And you're just going to kind of squeeze. It just keeps any blood clots from getting in there. It doesn't mean that you're going to get anything more to come through that. It just means that you're keeping the blood clots from going. Then we'll give you a cup to measure. When this bulb gets under 10 cc's, tonight we just want you to empty it. Tomorrow we want you to start measuring it whenever you wake up. We want it to be under 10 cc's, which is going to be on a cup that we give you. To empty this, you just take the cap off, you'll squeeze it out into the cup, and then you'll just put pressure back on it again. Tomorrow you're going to come into the office. We're going to take this dressing off. It's just one stitch that holds it in. We're just going to clip that real quick with some scissors and it's out. Usually doesn't have much pain, if any, with that. Usually feels much better to finally be out. Activity tonight, we don't want you lifting anything tonight. Tonight you're really just going to take it easy. As far as after tonight, you're going to nothing over 10 pounds, which is basically a gallon of milk. We don't want you to raise anything up over your head. You can say no, but we don't want you to say yes. No flexion extension, you can do that, but that is actually something we just want you to not do for 6 weeks to allow the fusion to take place. Okay. No driving for approximately 2 weeks. When you feel like your reflexes are good enough to drive, when you can move your head from side to side and you're no longer taking pain medication, then you're okay to drive. You're going to wear this collar while you're sleeping or driving in a car up walking around for the first 2 weeks. After that, you really only need it if you're in a car or if you're up doing strenuous activities. If you don't want to sleep in it, some people find it more comfortable to sleep in, some people don't. We're fine either way. You'll come back in 6 weeks and see us and physical therapy. They're going to go over some exercises with you to help strengthen your neck back up. Since you've had this going on, you lose that muscle mass pretty fast. As far as your incision, you're going to keep your incision dry tonight, no shower. Tomorrow, once we take the drain out, you can take a shower. The waterproof dressings that we had you get, you'll put it over your incision while you're in the shower. Once you get out of the shower, you can put some Neosporin and then just some 4x4s and some tape over that to cover it. After 1 week, we no longer want you using Neosporin. It can actually cause the incision to kind of stay to where it might get infected at that point. If you have any questions about any of this, just feel free to call us or send us a patient portal message. We want you to really try to get as much sleep as you can the first few weeks. The more you kind of let yourself heal on the front end, it's easier. Okay. We want you up walking as much as tolerated. The more you get up and walk around, especially right after surgery, is good. We want to prevent any blood clots from happening. Okay. We also want you to take deep breaths. About every hour or every 15 minutes, we want you to take a really deep breath, even if it causes you a little pain, because we don't want you to get pneumonia. It's common to have a low-grade fever for the first couple of days. In about a week, if you still have a fever, we want you to give our office a call. We want you to give us a call if you have a fever, but in a week, if you have any yellow or green drainage, any fever, we want to make sure you give us a call so we can take a look at your incision. Pain medication, we give you some pain medication. We want you to take it. It can be taken every 4 to 6 hours. We also give you some muscle relaxers for this surgery. You can take that. You want to take those at different times. You don't want to get too much medication at the same time. Okay. Returning to work, This is going to kind of depend on your job and what you do. If you do a desk job, you maybe can go back in a week or two. If you're doing anything that's your lifting requirement, then it may take 6 weeks to possibly 6 months, depending on what your job is. If you have any other questions that come up tonight, there's a number on the discharge instructions that you can get a hold of the physician at any time. We're here day and night, and otherwise we will see you tomorrow to get your drain taken out.
Okay, thank you.